Hi, my name is Misty Puckett. I'm a clinician here at Middletown Clinic, and we'll be going through an intake assessment with you today. What's your name?
Hi, my name's Elizabeth Smith.
It's nice to meet you, Elizabeth. Is that the name you prefer?
Yes,
My preferred pronouns are she, her. What are yours before we get started?
I prefer she, her as well.
The intake assessment we are doing today should take about 15 minutes, maybe a little longer, and I will just be asking you some background information to help me better serve you going forward. Everything we discuss here is private and confidential with a few exceptions. If you mention a risk of harm to you, another person, an older adult, or child, I would need to report that. Also, I'm under clinical supervision, so I may discuss your case with my supervisor. However, she is also bound to the terms of confidentiality. Do you have any questions about anything I've talked about so far?
No, I think I understand.
So, Elizabeth, it says here in your intake paperwork that your birth date is November 24th, 1988. Is that correct?
Yes.
That's close to Thanksgiving and not too far away. Does your birthday ever fall on Thanksgiving?
Yes, actually, I was born on Thanksgiving. It has hit the same day maybe twice more during my lifetime.
Oh, that's cool. Happy early birthday. It says here that you were referred by your primary care physician, Dr. Jones. Why do you think Dr. Jones referred you here?
I've been having these episodes where my heart starts racing and I almost pass out and it feels like I'm dying. And this lasts for about 10 to 15 minutes, then I'm back to normal. It started about 3 months ago and has happened every other week since they started.
Mm. When was the last time you had one of these episodes?
Just a few days ago, actually, before I went and saw my doctor about these episodes, I had been to the hospital because it scared my husband so badly, and I was afraid I might be having a heart attack.
Mm. I can only imagine how scared that made you and your husband feel. What did the hospital have to say about it?
They said I was having acid reflux and wrote me a prescription for Prilosec.
Mm.
However, I've had acid reflux, and that's not what this is.
Mm. You mentioned accelerated heart rate as a symptom and feeling like you're going to pass out and experiencing a fear of dying. During these events, do you find yourself sweating more than usual, experiencing any nausea, chills, or feeling as if you're losing control?
Really? Well, maybe I feel like I'm losing control. I'll be honest, when I'm going out places now, I'm worried that I might have an episode in like a store and then pass out in front of a bunch of strangers. So I've been staying home more the last few months.
It sounds like you're avoiding certain places or situations for fear of having an episode while there. Are you persistently concerned or worried about additional episodes or attacks?
Absolutely. That's exactly why I decided to go to my doctor for help. I'm so tired of living this way in constant fear. And I just want to understand why this is happening and what I can do to make it stop.
That is a lot to handle, and I can see why you would say that you're living in fear. When these episodes occur, is there anything happening that you think may be causing them?
Not at all. It's the craziest thing. I can be out gardening, doing something I love, and then it hits me out of nowhere. And one time I was watching a TV show and I had an episode.
You said the episode started 3 months ago. Did anything happen 3 months ago that may have triggered these episodes to start, like any big life changes or particularly stressful events?
No, not really. Well, I mean, I guess my dad was hospitalized about 3 months ago with pneumonia, and with his poor health, he almost didn't make it. And it was touch and go for a few weeks, but he is out of the hospital now and doing fine.
Oh man, I'm sure that was hard for you coming so close to losing your dad. I'm glad to hear he's doing well now. Um, in the spirit of safety, I have to ask, have you ever experienced any suicidal or homicidal thoughts?
No, nothing like that.
Good. Have you ever heard or seen anything that others said was not there?
No.
How would you describe your mood today, and generally speaking?
I mean, today I'm a little anxious coming here, but fine other than that.
That's understandable. Have you been experiencing any symptoms of depression lately?
No depression, just feelings of worry related to these episodes I've been having.
Mm. Have you ever been to a psychiatrist or therapist before this for any other reason?
No, I've never really felt the need to until now. I mean, I've always struggled with some anxiety, but not to the extent that this is interfering with my day to day.
Sounds like until the episode started, you never really felt you had a reason to see a therapist. So I'm guessing that you've never been prescribed any psychiatric medications.
Correct.
Has anyone in your family ever dealt with anxiety issues, like parents, siblings, grandparents?
I mean, my mom has always dealt with anxiety. It was common in my childhood for my mom to back out of taking my sister and I places, saying her nerves were bothering her too bad. And if a storm came, she assumed it was going to be a tornado and would take us to the storm shelter my dad had built for her on the side of the hill behind our house.
I'm sure that was disappointing and stressful as a kid. Has anyone in your family ever suffered from any psychiatric issues?
Not that I'm aware of.
Has anyone in your family ever struggled with substance use issues?
My dad was an addict in my childhood, actually. He even sold weed when I was young. And then I later learned it was to pay for his pain pill habit.
Mm.
And that really took a toll on him. He's no longer an addict, but it is only because he is physically unable. His health is in terrible shape.
Oh man, that has got to be tough, and it can be traumatizing watching a parent or anyone you love struggle with addiction. I'm so sorry to hear that his health is so bad now. Do you still have a relationship with him?
Yeah, I see him often, and I'm probably closer to him now than I was before. He's actually a pretty great person without all of the substances masking his true self.
It sounds like you were able to repair your relationship with your dad once he got sober.
Yeah, for sure. There was a time I didn't think it would be possible.
Have you ever used drugs or alcohol?
I used to drink on the weekends in high school and college, maybe smoked weed a few times, but nothing too serious. I don't drink now except a drink socially with a friend a few times a year. With my dad's history of addiction, I have always been mindful that I may be prone to developing an addiction myself.
That's impressive that you've had the strength and self-awareness to guard against any possible addiction issues developing. I applaud you for that. We have
Thank you.
talked about, sorry, we have talked about your mom, dad, and sister briefly. Was this all who lived with you growing up?
Yeah, it was me, my sister, dad, and mom. However, my mom and dad divorced when I was 13. And at this point, I moved in with my mom and eventual stepdad.
That can be tough. That can be a tough age for a child to experience a parent's divorce, plus having to move from your childhood home. In the beginning of our session, you mentioned your husband. Is that your only marriage?
Yeah, we married in 2012 and have been married since.
Do you have any children?
No.
So, what is it that you do for work currently?
I work at Fifth Third Bank actually, and I've had this job since I graduated college in 2014.
So, you've been working there about 9 years. Did you graduate with your bachelor's degree then?
Yeah, I have a bachelor's degree in business.
Cool. Have you ever served in the military?
No,
And have you ever experienced any verbal, sexual, or physical abuse in childhood or adulthood?
thankfully I've not.
Who would you describe as your support system?
I'm definitely my husband, and my sister is my best friend, so she is my go-to for decompressing and sharing what is stressing me out in the day. I have a few friends I can count on for support as well, although I don't see them as much as I would like to.
Sounds like you have a pretty great support system. Have you ever had any legal issues?
No, I've only ever had one speeding ticket.
That's pretty good. I just have a few more questions. Have you ever had any medical conditions or issues?
Nothing major. I mean, I do have acid reflux issues.
Okay. How about any medications you are prescribed, allergies, or history of hospitalizations?
Just the Prilosec I get for my stomach. The day I visited the hospital for the episodes I was having was just an ER visit and they didn't keep me.
Okay. Thank you for being patient through this assessment process. It can be hard talking about sometimes painful memories. When you came in with your intake packet, you completed a panic disorder screener or PADIS. You scored an 11 on this. It's on a scale from 0 to 13, so that's a fairly high number. Based on this and the information that I've gained from doing this intake assessment, I'm fairly confident that you have panic disorder. The episodes that you described sound like panic attacks. Um, the rapid heart rate, feeling as though you might die, feeling like you're going to pass out, those are all symptoms associated with a panic attack. And then the fear of having more um, is panic disorder, pretty much. There are lots of ways that we can move forward in treating this to help you get control of your life back. At your next appointment, I would like to develop a treatment plan. I want you to know that your input and preferences will guide this treatment plan. You are in the driver's seat. Do you have any questions for me so far?
I'm just thankful to finally put a name to what I have been experiencing these last 3 months. Will I have to take medication to manage these episodes or panic attacks, I mean?
If you don't want to be put on medications, you definitely don't have to. Cognitive behavioral therapy is what is commonly used. It's been shown in studies to be highly effective in patients diagnosed with panic disorder. It's a form of therapy that teaches you different ways of thinking and reacting to feelings that occur before a panic attack.
Thank you. That sounds like something I'd be interested in.
Great. If you don't have any more questions, then I will see you next week and we'll get started with a treatment plan.
Great,
Um,
thank you.
you have a great weekend.
You too.